Thanks for joining us for this edition of Inside Education. I'm your host, Mitch Truswell. Long-term projections by the state of Nevada show an additional 24,000 healthcare workers will be needed in the state by the year 2024. Now that includes everything from doctors and nurses, physician assistants, psychologists, as well as medical assistants and certified nursing assistants. The Clark County School District's Career and Technical Education, or CTE programs, are helping to fill some of those needs. Students in a nursing or nursing assistant program offered at several CCSD high schools can earn college credit while attending medical-related classes in high school. Some, as is the case with certified nursing assistants, can go directly into the workforce after graduation, provided they pass the required certification. They can also choose to continue on with post-secondary education as well. In our continuing look at the many different types of CTE programs and how they are helping to meet the needs of our future workforce, we went to East Career and Technical Academy. That's where Kathy Webb, who's worked as a nurse for 21 years, is training students for their futures.
How do you know that you'll know the answers for all these tests and your inter-program exams? How do you know? You'll write them. And then what will you do? Write them again.
Kathy Webb wants her certified nursing assistant students to know the nursing basics like the back of their hand. In her certified nursing assistant or CNA program at East CTA, there are class lectures and labs, and her students have to earn the opportunity to work in her hospital setting situated in the back of the classroom.
Okay, 1, 2, 3. If you want, you could hold my shoulder.
Andre is one of those students with classroom hospital privileges. He plans to pursue nursing after high school.
Your knees. Okay. 1, 2, 3.
As a member of the CNA program, once he graduates, he'll just need to pass a certification test to work as a CNA, which he'll do part-time while attending UNLV.
I feel that with the knowledge and skills I have learned here in this program, I'll really benefit from it.
He's always wanted to be in the medical field, but he credits his teacher, Miss Webb, with helping guide him and provide part of the drive to succeed.
She's one strict teacher, but you know what? It's going to be worth it in the end when we pass that test.
In the classroom hospital, CNA students practice the basics, taking blood pressure, temperature, pulse, and moving patients into wheelchairs. These CNA students also spend time at the Veterans Home in Boulder City, working and interacting with patients, something student Nayeli Macia says is extremely important.
This program, honestly, it's life-changing. Sometimes, kids focus so much on academically, getting their grades and stuff, but they don't realize, doing community service or internships at hospitals, you need to expand on your, people skills. And it really gives you that people skill kind of thing when you graduate high school that many students don't have because they don't experience it.
Kathy Webb spent most of her career working in neonatal intensive care units around the country, including here in Las Vegas. She wanted to have an impact on the next generation of nurses.
And the only way to do that is to start with their little young hearts and hopeful brains and instill in them what nurses should do.
She knows the CNA program also gives students the tools to earn a living while they continue on with post-high school education.
It's automatic income for their families and for them. It's a part-time job that allows you to work through college, and I have many students who have their CNA license that work through college part-time that have been able to move out of their parents' house.
Recently, the school learned students will be able to take their CNA certification at this school, utilizing all the familiar equipment they've already been using in class. Webb expects all 57 students to pass. There is often a waiting list to get into the CNA program. Webb knows there is a big need for medical workers in Southern Nevada, which means her students have a bright future.
So many people think that CNA students they're only going to get a job working with the elderly, or they're only going to get a job on med-surg, but they will get a job in pediatrics. They will get I just had a student come back from last year that's working at Pediatric Rehab Center as a CNA, and the jobs abound.
The following CCSD schools have or will have next year nursing or nursing assistant programs. They are East, Southeast, Southwest, and West Career and Technical Academies, as well as Western High School and Canyon Springs High School. Well, joining me now to talk more about what possibilities exist After students complete a program like this in high school is Dr. Catherine Prado-Lefkowitz. She's Director of Nursing Education for the Nevada State Board of Nursing, and also Leticia Wells with College of Southern Nevada's CTE College Credit Program. Welcome to both of you. Thank you for being here. Dr. Prado-Lefkowitz, let's start with you. From your position with the State Board of Nursing, why is it important to have a pipeline, students in high school willing to do some of the work so that they can be a CNA? I'm assuming we have a shortage of nurses, right?
We do have a shortage of nurses, like every other state in our country.
Right.
We also have a shortage of CNAs and licensed practical nurses. So currently we do have CNA programs in the high schools, graduating them in 12th grade, allowing them to get their CNA certification. Hopefully coming up with new innovative ways of increasing that pipeline, maybe introducing a licensed practical nursing program in the high school so that students can easily move from one step of the healthcare profession through the next in a seamless manner.
Right. And you were talking about this, kind of tracking how these students do. Some of the students, some that go on to college with their CNA certification, maybe they're working through school or something, sometimes they struggle with some of the math and science aspects at the college level.
Correct.
So that's one of the things that you're working on, maybe move some of the math and science work into high school, correct?
Correct. So currently we do introduce college math and English into our CTE programs that you're going to hear about a little bit later. But I have heard from working with community partners that our students are struggling at the college level with math, science, and English. So one of our initiatives are to move those college courses into the high school level,
right,
along with giving them these opportunities to have certifications and possible college degrees when they graduate, so that we excite them and show them that there is a pathway. And you can do step 1 and possibly step 2 in high school, and then continue on to medical school or physical therapy school or whatever else you want to be.
Yeah, whatever you want to do. Okay, Leticia, let's talk to you about CSN and how closely they work with CCSD to make sure students are aware of all the CTE programs, because there are, I think you said, like 40 different programs
Right.
that they can get involved with, right?
Right. We currently have articulation agreements in 40 plus different programs, and so all high schools have various CTE programs. We work very closely with CCSD to ensure that we create additional opportunities for students, whether they're pursuing a health field or otherwise. And we certainly do this in order to, to match up the students' educational, professional, personal goals with secondary education to create that pathway and that bridge.
Right, because there's such a huge benefit for students. And I asked you this just a second ago. Are all students aware of how much they can get done in high school, which saves money in the long run? You don't have to pay for a college class.
Right.
Do you find that students are aware of this benefit that they have with CSN?
Not all students are aware of it. We work really hard to try to promote that message that there are programs sponsored by CSN where students are able to get started in college or with college courses in high school. And so we work with CCSD schools very hard every year to put out that message.
Right. Dr. Prado-Lefkowitz, you mentioned a second ago the LPN program.
Yes.
So this is a pilot program, and it's going to be at Southwest CTA, correct?
Correct.
So how will that benefit, I guess, how will that be different than the CNA Now programs we have now? How will it benefit students? How will it benefit the community?
Right, so the programs that we have now for CNA, the CNAs graduate that program in their 12th grade year. We're now going to bring that CNA program down to the sophomore year so that you finish your sophomore year with a CNA certification.
Wow. Okay.
that you receive through the State Board of Nursing. So then you have a license to go work during the summer. And then we are thinking about bringing this pilot LPN program to the high schools to have students complete an LPN degree by the time they graduate high school. So they leave high school with a college degree as well as a high school diploma, which will allow them much better access to further their advancement in the healthcare professions, whether it be nursing or whatever else.
Right.
And then they're still going to have their CNA certification. So as they're going through nursing school or physical therapy school or whatever, they can still work as a CNA and still help in those areas of need that we have.
And when we said LPN, just for those who don't know, that's a licensed practical nurse.
Correct.
Okay, so we're out of time, but I guess bottom line is there's a lot that students can take advantage of at CSN if they want to pursue many fields, but in this case, we're talking about medical fields. Thank you so much for your time, both of
Thank
you.
you.
Appreciate it.